Hello, I'm Dr. Faisal Khan, Director of Public Health for Seattle and King County. Have you ever wondered how public health pays for things like measles investigations or tuberculosis control? What about getting life-saving health information out to the public, expanding our ability to fight fentanyl, making sure beach visitors are safe from sewage, or helping people sign up for health insurance? Chances are these critical services and many more are made possible by something called Foundational Public Health Services, or FPHS. The best way to think about FPHS, it's like public safety, utilities, or roads. Just like we all need firefighters, clean water, and working highways, we also need a strong public health system. FPHS are core services that are important to be available everywhere in the state, because disease emergencies and other health needs don't stay within the boundaries of one county. If basic public health services don't exist everywhere, they don't exist anywhere. What makes FPHS unique is that it supports 4 key partners working together: local health departments like ours, the Washington State Department of Health, the State Board of Health, and sovereign tribal governments and health centers. This collaboration is one of the most innovative aspects of FPHS. It allows us as a system to prioritize resources, fill gaps, and make sure that every community, big or small, has access to essential public health services. FPHS didn't emerge overnight. It was a 10-year effort that brought together all 4 parts of the public health system to define what core services needed to be in Washington and figure out where the gaps are. Then we worked with the state legislature to codify all of this in state law, and then to start funding those services. We haven't filled all the gaps so far, but we're working on it. Let me share a couple of examples of the amazing work we are accomplishing with FPHS funds right here at Public Health Seattle and King County. Tuberculosis cases are rare in many smaller counties, so they don't always have the expertise to handle complex cases. Thanks to FPHS funding, we created the Washington TB Control Network. This team, which is housed at King County, provides training, technical support, and expert guidance to other counties when they experience a potential TB case. Leveraging our expertise with folks across the state has improved TB diagnoses and treatment, slowed the spread of this disease, and strengthened public health in every Washington community. Another powerful way FPHS is strengthening public health is by improving our ability to respond to disease outbreaks and other emergencies. With FPHS funding, we established an incident management structure to guide our response to recent outbreaks of mpox, measles, and varicella. And this can be used for future emergencies such as bird flu. We can now make faster, more informed decisions, ensure resources are deployed efficiently, and share critical information to help contain the spread of disease. Thanks to FPHS, we now have dedicated staff for planning, training, and emergency exercises, which makes us better able to coordinate with cross-sector partners and communities to respond more effectively, protect health, and save lives. FPHS is also strengthening public health communications. With FPHS funding, we hired a full-time media manager to improve our ability to quickly respond to hundreds of media inquiries each year, ensuring timely and accurate health information reaches the public. This role has helped build strong relationships with multilingual and community media, increasing coverage of key health issues for non-English speakers and communities of color. Over time, this expanded reach will help more residents access actionable health information and strengthen trust in public health. Another vital way FPHS is making an impact: supporting food safety at donated food distributing organizations. With FPHS funding, we support 2 dedicated staff members who work with over 400 food banks, pantries, shelters, and summer meal programs to promote food safety. Through educational visits, inspections, and free food safety workshops, we help to ensure safe food handling practices, services that were previously limited to organizations that could afford permit fees. We also investigate foodborne illness outbreaks and support commissary kitchens to expand safe food options. By improving food safety at donation sites, we help prevent illness while increasing food security for vulnerable communities across the county. Another great example, our language access program. With FPHS support, we've built a multi-county language access system to translate, interpret, and simplify health information, not just for King County residents, but for participating public health programs across Washington. This ensures more people, regardless of the language they speak, have access to critical health information and care. Public health is facing huge challenges. Declining vaccination rates, emerging health threats like bird flu, the overdose crises, the growing impacts of climate change, an infodemic that makes it hard to sift through and find reliable, credible health information. FPHS helps us meet these challenges head-on with dedicated staff, effective, efficient programs, and incredible community partners. We're working every day to make sure public health works for all 2.3 million residents of King County and across the state. Because at the end of the day, public health is a tremendous public good, and FPHS helps keep it strong.